Crystal Rogers, and today I'll be speaking to you on research which was conducted on diabetes education and whether standardized education has a better impact on hemoglobin A1C levels compared to an individualized, more tailored education. It's common for newly diagnosed diabetics to be referred to a standardized education class on diabetes management. In many cases, it's an actual class that's held annually in a group setting where general information regarding physical activity, signs, symptoms, and dietary requirements are provided to diabetics. However, in a more individualized or tailored education program, the client is highly involved in self-management. Goals are established, involvement of family and friends are encouraged, alternative dietary suggestions are recommended to accommodate cultural food preferences, and follow-up participation is initiated by clinicians. As you can see, I've analyzed the PICO process to assist in my research for the best nursing management of diabetes education. The target population are individuals who are diagnosed with type 2 diabetes. The intervention to be applied is individualized, tailored education. The comparison will be the packaged education program, or standardized education, which is offered to all diabetics. The expected outcome is the improvement of their hemoglobin A1C levels. My PICO process poses the question, does tailored education improve hemoglobin A1C levels better in patients diagnosed with diabetes compared to patients who receive standardized education? I utilized 4 databases to conduct my search. The first was Medline. I used the keywords tailored, diabetes, and education, and limited my search to systematic reviews, dated between 2007 and 2014. I received 65 results of full-text articles. Cumulative Index to Nursing Allied Health Literature, or CNAL, was my second database. Keywords utilized were diabetes, education, tailored, and hemoglobin A1C. I limited this search to full-text articles that were written in English. This search only yielded 1 result. The third database was Gale. I used some of the same keywords as earlier, tailored, diabetes, and education, in a search of all clinical studies, dated between 2008 and 2014. The result was 3 articles. Lastly, the final database is PubMed. I limited the search to meta-analysis articles within the last 5 years and used keywords diabetes, education, and tailored. The final result was 85 articles. In an effort to determine the best approach in regards to nursing practice, I narrowed my research to 3 articles. All 3 articles address my PICO question to some extent. The first article, Culturally Tailored Education for African Americans with Type 2 Diabetes, was a good source of data. Information in this article was obtained from 10 separate research studies. CNAL, Medline, and eJournals was the source of the research studies. And for confirmation, the reference list of studies identified were reviewed to identify any possibilities of omissions of electronic database searches. An easy-to-follow table was created to evaluate and compare variables. The researcher's technique was collecting recording data was clear and concise. After review, findings were consistent in a 1% decrease in hemoglobin A1C levels when participants were provided with tailored education. The only downfall that I saw with this article was the failure to include the hemoglobin A1C levels for all 10 studies which were researched. The next article, which was beneficial in providing research, was titled Culturally Tailored Education to Promote Lifestyle Change in Mexican Americans with Type 2 Diabetes. This article refers to a randomized control design which consisted of 2 groups. The control group had 8 participants and the intervention group consisted of 9. In this study, there was a slight decrease in hemoglobin A1C levels, but not enough to reach statistical significance. There was, however, a mean weight loss of 5 pounds for the intervention group. Weight loss has been seen to decrease the risk of cardiovascular disease. Questionnaires were used to measure self-management behaviors, diabetes knowledge, and self-efficacy. Disadvantages to this study was the small size of the sample group, consisting of only 17 participants, the short intervention period, which only lasted for 8 weeks, and self-reporting with questionnaires. The final article used in my literature review was titled Effectiveness of a Community Health Worker Intervention Among African American and Latino Adults with Type 2 Diabetes, a randomized controlled study. In this trial, 164 participants were provided with tailored education on self-management of diabetes, clinic and home visits during a 6-month period, and clinic visits with their primary care provider. Results displayed a decrease of hemoglobin A1C levels from 8.6 to 7.8. Physiological measurements of hemoglobin A1C was obtained from medical records in different phases. Baseline information was obtained 5 months prior to the study beginning, and again at 9 months after the start date. One weakness to this study was self-reporting, which was used for some data collection. As we know with self-reporting, there is always a possibility of the individual either under or overstating information. In my nursing practice, I frequently come in contact with a diverse group of patients who have been diagnosed with type 2 diabetes. Based on review of these studies, it would be beneficial for patients to become tailored or to receive tailored educational diabetes management to decrease hemoglobin A1C levels. For future interaction with type 2 diabetics, I'll focus more on individualized care of the patient, taking cultural backgrounds into consideration. I'll also set out to develop trusting relationships as we aim to set realistic goals. Of course, this can only be achieved if the patient is open and willing to make a change. If this is the case, I will assist with alternative dietary choices, taking current lifestyle and cultural preferences into consideration. Individualized physical activity plans will be developed based on resources and abilities of the patient, and education will be provided based on the learning abilities. The patient will be coached and encouraged to build on self-management skills, which could potentially decrease blood glucose levels and ultimately improve the quality of life of the patient. This concludes my presentation. I hope you enjoyed.